Hey guys, this is Dr. Kelsey, and this is Lanikai, and me and Jen here are checking Lanikai's ears. She is about a 20-week-old red lab. We'll talk about that later in another video about labs, but I want to talk about ear cleaning. She's had an ear infection already once before, so this is actually a recheck. But ear cleaning, a lot of people ask, should I be cleaning my dog's ears? And here's my answer. If it's not broke, don't try to fix it, okay? So what I mean by that is if your dog's not really a chronic ear infection dog, I truly wouldn't recommend cleaning your dog's ears out on a frequent basis, okay? Now, if you've got a dog that's an allergy dog or that has ear infections and things like that frequently, like 2 or 3, 4 times a year, then I would clean the ears, okay, on probably a weekly or every other week basis. And when you do that with ear cleaning, we use epiotic here. There's a couple other solutions that are out, of course, on the market. And you're just going to squirt a little bit in the ears, okay? And usually we'll take some gauze, or at home you could just do some cotton balls. And you're going to wipe the ears out, kind of get the extra. Now again, the ears really aren't too bad here. And you may have some Q-tips or small Q-tips at home. Generally, now it depends, of course, on the size of the dog. We've got a lab here, but I'm going to go maybe an inch or so in there, 1.5 inches. It'd be very rare for us to hit the eardrum. And we're just going to kind of wipe around the crevices and in there. And of course, they're going to do their part too, because as soon as we stop, they're going to start shaking, just like that. So they'll do their part about getting some of that ear rinse out. So we just kind of, I call it kind of squeegee it. And put some in there. Again, we're going to get some gauze, or again at home, just a cotton ball or two, and just kind of dig in there. And this is the ear actually that had the ear infection. And as you can tell, it's a little bit brown. Generally speaking, when people ask if they have an ear infection, I see there's 2 things. One, the ear's going to be red or inflamed, and the ear's going to have some gunk or junk or discharge, right? Some brown, brownish black stuff. So here you see a little bit of brownish black stuff on the Q-tip. Again, 1.5 inches, and just kind of massaging around. Again, it's very uncommon, very unlikely you're going to hit the eardrum. Now, if you have a little dog, obviously you're not going to go that far. But so we've cleaned the ears out. So that's a little bit about ear cleaning. Again, unless your dog has a problem, I really wouldn't worry about it. Like, you're a good patient. And so a lot of people ask and wonder about, what are we doing with our ear swabs when we get the little Q-tip and we swab your dog's ear, and we take them to our lab, and under our microscope, we are actually looking for bacteria and yeast. So what we do is we swab that Q-tip onto a glass slide, and then we stain it. There's a couple of stains that we put them under, and then we let that slide dry, and then we'll take a look at it. And so we're looking for bacteria and yeast. Bacteria can come in different varieties, of course, just like anything else. There are some that are more severe, called like Pseudomonas, and they have a certain shape. And then there's cocci, like a staph infection. And then yeast in general is usually Malassezia yeast. And based on that, it helps us determine, of course, what medication we're going to use for the ear drops or ear ointment or ear medicine. So, and how severe it is too. So we can quantify and then decide which bacteria and which yeast are going on. So that's what we're doing on the ear swab test.